Hello, my name is EshikaParuchuri, and I'm studying 11th grade at the Woodbridge Academy Magnet School in New Jersey. I would like to begin by thanking you for joining me in this initiative. My main objective is to educate and empower adolescents around the world by helping them to construct a healthier lifestyle by working with experienced doctors across different specializations around the world. In addition to promoting health education, I hope to inspire interested teens to pursue careers in healthcare, not just as future leaders, but as individuals prepared to respond to urgent public health challenges, from everyday medical needs to global crises like the COVID-19 pandemic. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Abhilash Sunkesula, who specializes in arthroscopic surgery. He has vast experience in this field and is currently working as a consultant arthroscopic surgeon at Amor Hospitals in Hyderabad, India. And for this episode, we'll be focusing on general orthopedics and arthroscopy, public health issues that concern teens, and steps that can be taken to have a healthy lifestyle. Now, Dr. Sunkesula, can you give us a little background regarding your experience in this field?
Yeah, hi Eshika.
Hello.
So glad to meet you. Yeah. So I've been practicing arthroscopy since 15 years. Yeah. So that's how I got it. I'm an orthopedic surgeon, who deals primarily with arthroscopy. I do joint replacements as well. Yeah.
Nice. Now let's dive right into the questions.
Sure.
Starting off with some basics related to arthroscopy. What exactly is arthroscopy?
Well, arthroscopy is a surgery where we do for the joints, where we put a camera into the joint and fix the issue. So it's this minimally invasive. Yeah.
And how is arthroscopy different from traditional open surgery?
Yeah. When compared to traditional open surgeries, arthroscopy are minimally invasive surgery where we place small keyholes and we put a camera into the joint, and through these small keyholes we fix the ligaments. Whereas in traditional surgeries, we need to open the joint, which causes more bleeding, more tissue injury while surgery. So that's how arthroscopy helps fixing joints with less trauma surgically.
And what kind of joint problems can be treated with arthroscopy?
Yeah, that's a good question. The problems which are commonly treated with arthroscopy are ligament injuries, meniscal injuries, cartilage issues. In shoulder, we deal with labral tears, where patients suffer with dislocation of shoulder. We deal with cuff repairs. We deal with cysts in the joints. We deal with any impingements in the joints, say in hip joint. And we deal with the stiffness in the joints where we release capsules arthroscopically. So that's how we do deal with those specific situations using arthroscopy. Yeah.
And why do you believe arthroscopy is such an important tool for orthopedic surgeons today?
Yes, it's a very good tool. This has been since a long time. Arthroscopy has come into limelight since long time. It's a very useful tool for orthopedic surgeons to help treat joint problems in a minimal invasive manner so that the patient can get back to their normal routine at a quicker pace.
And is there certain requirement for a patient to be fit for arthroscopy?
Yeah, I mean, requirement in the sense, first of all, for any surgery, we need to see whether they are fit for anesthesia. Though for those things, we get the blood test and check how their organs are functioning. Once they are ready to go, then we see the specific problem to be dealt with. If that could be dealt with an arthroscopic surgery, then that's the best thing to do. If it can't be fixed by arthroscopic surgery, something like a joint degeneration where we need to do a joint replacement, then we need to do a joint replacement. So for those specific indications, arthroscopic surgeries are the best way to deal with.
Okay. Now let's transition into talking more about recovery and patient care. First off, how does recovery typically look like after arthroscopy?
See, the arthroscopic surgeries can be daycare surgeries. We can operate them in the
Mhm.
morning and send them home by evening. And there are conditions where we make them bear full weight on the leg on the
Mhm.
same day of surgery. And of course, there are certain conditions where we don't allow bearing weight, something like cartilaginous injuries where we fix the cartilage, we want them to give rest. But most of the indications, we make them bear weight straight away. So the recovery is pretty fast. And when we deal with cuff repairs and all, where the visibility using an arthroscopy is about 8 times than the normal vision. So the way how we fix those specific injuries is much more precise, and the fixation as well is quite robust. So we rehabilitate them quite early. We mobilize the shoulder early when you're doing surgeries with an arthroscope, and as the surgical trauma is less, so the pain as well is pretty low for the patients. So
Mhm.
that's how it helps in early rehab, and they can get back to their active lifestyle at a rapid pace.
Mhm.
And even cosmetically, there aren't any incisions on the body, and the incisions are pretty minimal. They're just stab incisions, so they don't leave big scars. So
Mhm.
that in that way as well, arthroscopy helps. Yeah.
And are there any other factors that generally influence any like post-op rehab?
I mean, pretty
Maybe.
much it. Pretty much it. Yeah.
Okay.
So the factor, depending upon the indication of the specific surgery which you are doing to that specific patient, the rehab varies. So each indication has got its own rehab. So something like, if you're doing just an arthroscopic meniscectomy, then they can get back to the routine quite early. When you're doing an ACL reconstruction, then we need to allow the graft to get vascularized, and that takes about 9 months. So there's a protocol which we follow. So each surgery has got its own rehab time. Yeah, and that's variable from surgery to surgery. Yeah.
Mhm. And how do you ensure patient safety during, let's say, like high volume arthroscopy days?
Yeah, the patient safety is utmost important when we're doing
Mhm.
any surgery. So we make sure that the neurovascular structures are pretty well protected,
Mhm.
and certain conditions where we are dealing with pathologies in the posterior aspect of the knee where the neurovascular structures are close by, then we take extra care not to injure them. When we're doing any arthroscopy in the hip joint or in the elbow, we take extra precautions so that the nerves and vessels are not injured. So when
Mhm.
we take those precautions, it's safe for the patient. Yeah.
And I've also wondered, does arthroscopy can it prevent future issues like osteoarthritis in any way?
Yes, I mean, see, any ligament injury causes instability in the joint, which leads
Mhm.
to early degeneration of the joint. So, by fixing the ligament using arthroscopic surgeries, we are giving a stable knee to the patient that decreases degeneration in future. So, yes,
Mhm.
that definitely helps when you're dealing any meniscal injuries where we are repairing the meniscus. Even that can slow down the process of degeneration. Likewise, when you're dealing with any labral tears where we repair the labrum in the shoulder, that decreases the instability, mobility, movement, excessive movement of the humerus on the glenoid. So even that will decrease the rate of degeneration. Yeah,
Mhm.
it definitely helps. Yeah.
What is the number one thing that you believe can make knees worse during rehab?
I mean, rehab is always good, but it should be in a protected manner for those
Mhm.
specific indications. Say each and every, as I said, each and every indication has got its own protocol. So that should be followed. We want mobility in that particular joint, but at the same time, we want to save the graft as well until it gets vascularized, until it gets its full strength. So that protocol needs to be followed to the T to get best results.
Mhm. How do you handle things such as surgical stress or fatigue?
Yeah, that's a. You mean to say doctors who operate on
Yes.
the system? Yeah.
Yes.
So yes, that's a very good question. So myself, there are procedures which would take time.
Mhm.
So even doctors should be fit to stand for that duration of time. to have same kind of surgical precision from the start of the surgery till the end of it. So the fitness is so important even for the doctor. I do workouts every day. I do aerobic and strength training each and every day. I spend good amount of time because most of our surgeries we need to stand for long duration. And it takes good amount of muscle power to get everything in position in shorter time. So I spend about 2.5 hours working out every day.
Mhm.
Yeah, to handle this issue, and I personally feel that helps a lot in my surgeries. Yeah.
Very nice. Okay, now we'll transition into sports and talking about more of teen and young adult orthopedics. Starting off, what are the most common orthopedic issues that you deal with in young adults?
Yeah, young adults, you mean to say arthroscopic surgery requirement in young adults? Is
Or
that your
any issues that you've dealt with um, while operating on young adults?
Yeah, see, young adults they tend to fall. Most common pathology which we see is ACL eversion fracture.
Mm-hmm.
So, like the elder age group, the younger ones, the ligaments are quite strong and the bone avulses, that is more common. So, when we are dealing with those kind of issues, we fix those ligaments, we fix those bone pieces. Sometimes we deal with ligament injuries as well in young adults. The thing in young adults is that they have growing bones. So, there is something called as epiphysis which helps us to grow our bones, which helps us to grow taller. So when we're doing surgeries, we make sure we don't injure the epiphysis because we don't want any deformity in the young adults once they grow older. Because when we injure a part of the cartilage, part of the epiphysis, then the rest and that part doesn't grow. The rest of the bone grows, so they end up in deformities. So we make sure we don't touch the epiphysis, and there are certain techniques where we use the bone above the growth plate, yeah, above the facial growth plate, and so that the growth deformities due to growth of the bone are avoided. So these are the main things which we need to take care of in young adults. Yeah, when the person is too small, then we need to have smaller scopes, smaller instruments to prevent injury to the cartilage of those small knees and joints.
Mm-hmm.
Yeah.
What is tennis elbow and how common do you come across that issue?
Yeah, tennis elbow is quite common. It's we call it as lateral epicondylitis.
Mm-hmm.
What happens is there are extensive group of muscles which originate from the lateral epicondyle. So the inflammation at the origin of these extensive group of muscles, which is from the lateral epicondyle of the humerus, is called as tennis elbow. The primary reason for that is when we don't strengthen our forearm properly, when we do excessive movements with our forearm, something like twisting movement. So where the load of your movement isn't taken by the muscle, as the muscle isn't strong enough, then the entire load of it falls on the origin of it. So we tend to
Mm-hmm.
develop small lesions, small tears in the origin of the muscle. We call them inertial lesions. So due to that, patients tend to have pain. So that's what tennis elbow specifically is. So how we deal with is primarily using medication to improve the health of the origin of those muscles, which is collagen peptide. And number two is we make them do strengthening exercises and stretching exercise for the extensor group of muscles. So due to that, the muscle gets stronger and slowly the pain gets relieved. Then we give them a splint as well, which is called as the tennis elbow splint, which
Mm-hmm.
helps us relax the origin. So we advise them to use that in their workplace. And the other way of dealing with it is we give injections over there. So the inflammation comes down. Injection could be a steroid or a PRP. Yeah, and if still patient is not happy with it, with the physiotherapy program with injections and all, then we do a small surgery. Yeah, where we debride, clean up the lesion, so that will decrease the pain. That can be done arthroscopically.
Mm-hmm.
Yeah.
How long does it usually take for a young adult or teenager to recover from a torn ACL?
See, there's no bed rest. We ask them to bear weight from day one. There will be range of motion
Mm,
exercises from day one. We progressively increase the range of motion exercise over 6 weeks. So till then, we make them do simple exercises, and after 6 weeks, we make them do stationary bicycling. Half squats will go on for about 3 months, and 3 months we ask them to do resistance training. We ask them to go to gym, push weights, and lift weights. They'll go on for about 6 months, and after 6 months, they tend to jog, and 9 months they run. So it requires about 9 months for the ligament to get vascularized, the graft to get vascularized. So 9 months they need to avoid sporting activity.
mhm. Can you still bend your knee with a meniscus tear?
Yes, of course, patient would bend the knee with a meniscus tear, but it hurts. So there will be joint line tenderness. There will be pain while bending of the knee joint. So that's how we get to know that there is some pathology in the meniscus. We get an MRI, we see a tear, and depending upon the tear, we repair it.
Mm-hmm. And any word of advice for how young athletes can protect their joints from long-term damage?
Yeah, they definitely need to do strengthening exercises.
Mm-hmm.
Then to go to gym, do some weight strength training before getting to the sporting activity. So they shouldn't jump into the sporting activity at one go. Instead, they need to do a bit of strengthening exercise for the time others get ready, and then do sporting activities. Yeah, that can avoid injuries. Yeah.
Okay. And now we'll be shifting gears into talking about advances and technology. How has technology in the field of arthroscopy changed in the past decade?
Yeah, it keeps changing pretty rapidly.
Mm-hmm.
Yeah. But the technology, the scopes which we use are pretty refined right now, and
Mm-hmm.
they're 4K technology which is just coming in, just coming, so that the visibility is much better. There are pumps, these advancements in the equipment is pretty rapid, and at the same time there is a good amount of research which is going on how to benefit the patient at a with the better surgery. So the implants are getting better day by day. The research is pretty good. So the kind of surgeries which you're doing, they're getting updated. They are progressively being increased, nowadays. So yes, always in medical field, the surgeries keep refining.
Mm-hmm.
Technology is advancing very well, and even the surgeries, the method of surgeries, the research, they're all are happening at the same time, so the patient gets benefited. Yeah,
Mm-hmm. And are there any new or exciting research areas in arthroscopy?
yeah, they happen all the time. They happen all the time. Each and every procedure is getting refined to provide best benefit to the patient. Yeah, so and that's the ongoing process. Yeah, and each and every procedure is getting refined. Yeah.
And follow up on that, are there alternatives to one type of arthroscopic surgery? Like, let's say, um, variations of knee replacement?
I didn't get your question. Can
Are there
you?
different ways to perform one type of surgery? Like, um, are there types of hip replacements and knee
Yeah,
replacements?
yeah. There are different kinds. There are different kinds, right from the implants which you use, and I know each company they keep advancing their implants which we use for those surgeries. Yeah, they happen all the time. But the doctor, as a doctor, we need to see if that really is going to benefit the patient. So the company guys, due to their financial things going on, they tend to push for costlier implants.
Mm-hmm.
But at the same time, the doctors need to see how good the implant is. No, something like is it really beneficial to the patient? Because what happens is, for example, in ACL reconstruction, they have come up with an internal brace where we have added a extra tape around the ligament. But is it really beneficial to the patient? Uh, so that thing doctor should choose wisely and see the studies which are going on, see the results, and then use it to the patient. That would be more beneficial rather than using the implants driven by the company.
Mhm. And how accessible is arthroscopy in developing countries?
Yeah, see, developing countries like India, yes, it's quite accessible.
Mm.
There are good number of surgeons who do arthroscopy. Yeah, so the number of surgeons who are doing arthroscopy has picked up rapidly. So nowadays, with the kind of research which is readily available throughout the globe due to internet, there are more number of surgeons who are operating using arthroscope.
Mhm.
Yeah, that number has gone up at a rapid pace. Yeah, there are actually thousands of surgeons just in one city,
That's
just in
very
one
nice to see.
city.
And now we'll be moving on to our last section for the podcast, which will consist of some common myths related to arthroscopy.
Mhm.
Myth number one: arthroscopy can cure arthritis.
Uh, yes, it can. It can cure arthritis by doing certain cartilaginous procedures where we put in autologous chondrocyte implantation and all. We
Mhm.
place cartilage cells in those joints. But if there is a global arthritis, then it doesn't.
Mhm.
But say if there is a small chondral defect, then it helps. So it doesn't cure global arthritis. Global arthritis would definitely require a joint replacement. But if there's a small chondral, it helps. But it can prevent arthritis. More often, once we do the ligament repairs, reconstructions, and all, we are stabilizing the joint, so arthritis will be prevented. Yeah,
Mhm. Arthroscopy is just for diagnosis, not treatment.
that's false. We diagnosis can be done with an MRI. You don't need an invasive procedure for diagnosis.
Mhm.
So arthroscopy is primarily for treatment.
Mhm. The smaller the incision, the easier the surgery.
Not really, not really. The smaller the incision, the tougher the surgery actually. The
Mhm.
bigger the incision, the easier the surgery. Yeah. So, but the benefit is the smaller the incision, the earlier the recovery
Mhm.
for the patient. Yeah.
Arthroscopy is only for athletes.
That's false. That's a myth. Arthroscopy is for each and every individual. So, because we even each and every common man jogs around, runs around, jumps around, so they need a stable knee for to prevent degeneration. So, if they don't have a stable knee, then they would land up in a degenerated joint, which would lead to a joint replacement.
Mm. And for our last one, which I myself am pretty curious about, cracking your knuckles gives arthritis.
Not really.
Mm.
Cracking knuckles is basically, due to air pockets which will move inside the joint. There's a
Mhm.
vacuum which is being created by by bending our joints. That's how we crack knuckles, and that's how sound is produced. And there's synovial force in the joint which will rub over the joint. So even that can cause sounds,
Mm.
crackling sounds. But in the longer run, it's not good to do that frequently because once in a while is okay, but if you do it frequently, you're going to develop some inflammation in the joint, which would lead to a painful joint. So it's better
Mm.
not to crack it. Yeah.
Okay, and I have two final questions. First one: what do you believe has changed most from when you first started working in this field to now?
You mean to say technology point of view or surgical
Any
expertise
view?
point of view?
Surgical, technology.
The surgical expertise definitely improves with the number of surgeries which are being performed by a surgeon.
Mm-hmm.
So the ease of surgeries and the way we do surgery, the confidence levels and all they pick up once the experience grows. And technology wise, from my beginning days till now, is as I said, it keeps progressing. It's quite
Mm-hmm.
it happens at a quite rapid pace. The kind of instrumentation which we get right now is much better than the instrumentation which we got at my early days. So this helps us to do the surgery quicker and perform surgeries at a rapid pace and give a better fixation to the patient. So the results to that specific patient will be better.
Mm-hmm. And second, could you tell us about one of your most interesting or challenging patient cases?
Yeah, there are plenty. Actually, we have challenges each and every day. Uh, yeah, the main concept is we tend to prepare for it. Yeah, before entering the operation theater, we look at the images and plan for the surgery beforehand. So once we plan for it, yes, a surgery goes on smoothly because we are prepared for any kind of complication which can happen during surgery. So yeah, there are plenty of challenging cases, but I personally feel the key way of dealing with them is to be prepared beforehand. Yeah.
Mm. And with that, our podcast session has now come to a conclusion. I would like to thank you once again for your time, input, and contribution. Thank you so
Thank you.
much.
Thank you so much. Nourish your habits to flourish your lifestyle.
That's for our listeners. Thank you.
Thank you.